it really also takes a lot of hard work to go through the medical training. So wherever you are, if you feel that that's your passion, and you have to be passionate about it. It says that as the saying goes, that nothing great was ever achieved without passion or without enthusiasm. So you really have to feel that this is what I want to do, and be passionate about it.
Awesome. Welcome to this episode. And as I told you earlier, in past episodes, I'm bringing amazing people to share their experiential stories. And today we are so privileged to have in our midst an amazing person. And I'll go into the details later, but we're going to be talking to a cardiologist. And you will be amazed as to his personal story, the journey that he's charted from childhood to where he is today. He's no other person than Dr. Fafa Xexemeku, and he practices as a cardiologist in the United States. And you wouldn't be blown away. You've seen the other episodes, and this is going to be one of those extra ones that you're going to be blown away. If you are interested in cardiology or anything medicine, pay attention. So, Doc, you are most welcome. Most welcome.
Thank you very much, Isaac. It's my pleasure to be here.
Awesome. So, Doc, if you don't mind, share with us what you do. I know you're a cardiologist. What you do and where you do what you do. That would be a great start.
Okay, so as Isaac has already mentioned, I'm a cardiologist, and I am a non-invasive cardiologist, which means I don't do a lot of surgeries, but I do what we call advanced cardiac imaging. So I do see patients, take care of patients both in the hospital and in the office, and then we do imaging studies. My specific area of expertise is using cardiac MRI and cardiac CT, which are what we call advanced cardiac imaging tools to help diagnose conditions and to provide appropriate treatment based on what we find on those studies. So that's in a nutshell what I do. Though I do really enjoy seeing patients, so but I also do a lot of imaging. So in some ways, I call myself a cardioradiologist because I do read a lot of imaging studies. Yeah.
Wow. I was going to ask that question. I was going to ask what's the difference between a radiologist and cardiac imaging. Maybe you may delve a little bit deeper into that for me.
Yeah, so I guess they are all really what I do partly is radiology. So in my hospital, and one of the things you asked me. So I work in Mercy Health in Wisconsin.
Okay.
So I'm currently located in Janesville, Wisconsin, but we have some other hospitals located in both Illinois and Wisconsin. So but I'm located in Janesville. So the real difference is this: basically, I have appointments both in cardiology and radiology because I do those advanced imaging procedures that are traditionally considered under the purview of a radiologist. So there are other places where you have radiologists reading these cardiac MRIs and cardiac CT. So it's basically that's why I said I'm a cardioradiologist in some ways.
Wow. That is amazing. It's kind of rare, though. Although I'm not in the medical field, that's not my area. But it's kind of rare to find people like you, though. Because I normally see a cardiologist or a radiologist. So having that too is amazing.
That is so. You are right in some sense that, and it takes additional training to do that from just your general cardiology. So if we do our general cardiology training, to be able to do what we call the advanced cardiac imaging, you have to do additional training. So it's I would not say it's an up and coming field, so you may not meet a lot of cardiologists who do. Very few cardiologists do advanced imaging at this point, but it's also a growing field. So
Yes.
hopefully, we should be seeing more people who do this from a cardiology perspective.
Awesome, awesome. I guess I'm just sitting here wondering, wow, how many cardiac or cardiologists who do imaging like yourself that we have here? But both from the perspective of Ghana and then the continent as a whole, I think it's just going to be fewer and far between, if I'm not mistaken.
Yeah, it's that is true. I try to my best to keep in touch with what's going on in Ghana. So I know there's at least one in Ghana. Yeah.
Oh wow, I like it.
Yeah, exactly. Yeah. So he's a good guy. He trained in Britain and relocated to Ghana. So it's, as I said, it's a growing field. Hopefully, we should be getting more of those. And even in the US, as I said, it's a field that started not too long ago. So you're not going to see a lot of this. But there's a good number, and so hopefully we can be able to get some of more people just also in Ghana who can do this read these modalities to help take better care of patients.
Awesome. Because I think for me, the young people need to be listening to things like this. This is cutting edge stuff. I just really enjoy this. So now, I'm going to put on my non-medical jacket, trying to poke my nose a little bit into the medical field. So when we talk of medical, is it about, let's say, image? I'm just going to take a wild guess, and you correct me if I'm wrong. So is it like taking images of, let's say, blocked arteries, or and enlarged hearts and those kind of things? You know, that's my non-medical jacket I'm wearing with a little.
No, I think you actually are right on point. Yeah, you probably don't need me here. You could just can just listen to because you really break it down to the point of the non-medical person. So you're right. So what we do on a more day-to-day basis is one of them is, as you mentioned, is really to determine whether people have blocked arteries and whether these arteries are causing their symptoms of chest pain, shortness of breath, or other symptoms, and how what would be the best way of fixing those. Are we going to put in stents or balloons to open it up, or are they going to need cardiac surgery? So that is one big chunk of what we do. And in the imaging field really is to find out whether people do have blockages or not before we send them for procedures to either open it up or even further define what we see on the imaging studies, what we call a cardiac catheterization, where basically we put catheters in the arteries and then into the arteries of the heart and shoot dye and take pictures looking for blockages. So, but also the heart has other functions in terms of the valves, the pumping action of the heart. So we do imaging, other imaging procedure that look mainly at what is going on the pumping function of the heart, what is going on with the valves, what is going on with some of the other vascular structures like the big blood vessels like the aorta. So we do what we'll call comprehensive imaging, looking at various aspects. So depending on what the clinical question is, we perform appropriate imaging to answer those questions and hopefully make our patients feel better and live longer. Yeah.
Wow, this is awesome. This is awesome. I think before we had this conversation, we're just having a little bit side chat about me always being the non-medical person, but I got my little toes in the medical field a few years back when I worked with a company in Dallas called Medasix doing healthcare supply chain. So I remember one of my first contracts that was given to handle was in the area of cardiology, and I didn't know anything about. I didn't know nothing. All I knew about was crunching numbers and presenting the numbers. And so, because of that disadvantage, I was actually made to watch a very terrifying video of an open heart surgery. I said, "Wow, God bless cardiologists." it was an amazing experience that I had. It's like, wow, is this what happens to human beings? And doctors go through this every day. So doc, my heart, I salute you for the work you do. It's amazing. It's amazing.
I think we just thank God for the grace and the strength that He gives us each day to be able to help people. Yeah, we actually, at least for me, it's a privilege to really be able to help people. That's how I see it. I don't take it for granted at all. Yeah.
Yes. That is awesome. That is awesome. So me, my foray is I knew a little bit about stenting. So for some young people who don't even know what it is, maybe we have to break it down a little bit for us. So
yeah, I know. As I was speaking, I was wondering how, but basically, a stent is metal. So when there's blockage in the arteries that supply your heart, what we call the coronary arteries, they will put in catheters, as we say, and then when we get into the arteries of the heart and should die and find the area of blockage, we then put in, and these stents are collapsed on a balloon so that they can just put it through that small the blockage, because normally the blockage leaves a very small area through which you could pull this. And once you put in this metal, then you inflate the balloon to open up the metal, and then it sort of pushes the blockage to and opens up the blockage. So it pushes the blockage against the walls of the artery and then opens up that blockage. And then the stent is supposed to hold whatever you've done in place so that you don't have re-narrowing of the artery.
okay.
So basically that's what a stent involves. And I know it may still sound a little complicated, but I think that's the best way I will be able to explain. Sometimes you need to watch it to be able to appreciate it, but basically, it's basically just the balloons that we use to open up blockages in the arteries that supply the heart. And then this metal is inflated and then tries to keep the area of opening intact so that it doesn't, as it were, narrow again. Yeah.
So the metal is more like a reinforcement.
Exactly. Yeah. So.
Okay. Wow. So I remember when I was watching that video, it was like a tunnel like that they push the balloon in, and the balloon gets to the place of the blockage. Then they inflate the balloon, and I don't know, leave the stent there. So which one is? I remember they used to say there was one of them, the Drugcoated. What does it do?
Yeah, so initially when the stents came, they had what we call them bare metal, but they are basically non-medication coated stents.
Okay.
So what was happening is that once you put those in, the tissues in the arteries were quickly growing back and causing more blockage.
Oh wow!
So in advancing the technology, they came out with what we call drug-eluting stents, or they are drug-coated, and basically the drugs in there are drugs that suppress growth of tissue so that they prevent re-narrowing, because basically in the blockage is developed by development of tissue, plaque buildup and all that. So you are basically suppressing that growth in the drug-eluting stent. So they've been a big game changer. So we see the incidence of re-narrowing of stents is very, very low at this point because of the improved technology and the effectiveness of the drug-coated stents.
Wow. So would you say that the use of bare metal stents is being discontinued, or are there cases?
I don't. It's at least in the industrialized countries. People argue that really there's no use for a bare metal stent in this day and age in our cardiac catheterization labs, where they do these procedures. Yeah, we call them cardiac
labs.
Yeah.
Wow. So young people, if you go to research what a cath lab is, and begin to position yourself to get into that area, because that area is amazing. I think a lot of research goes on in that area as well. So look, in your perspective, how prevalent is heart disease?
So it's It's very prevalent. Obviously, in a place like the US, it's still the leading cause of death. So
Wow.
it's very prevalent, and obviously driven by increased levels of obesity, and then resulting in high blood pressure or hypertension and diabetes and
Mm,
high cholesterol. And
okay.
then there's also a good segment of population who smoke cigarettes. So we have a lot of risk factors for heart disease. So that's one thing
Mm,
in general, but also heart disease is also a function of age. So the older you are, the more likely you are. So we have an aging population. So as you
okay.
live longer, your chances of developing heart disease becomes much higher just because of plaque buildups. Even if it's slow over time, it adds up. So uh, really, it's quite prevalent in as I said, the leading cause of death. So, as you said, a lot of research goes into cardiology mainly because of these issues. And I think we're seeing more and more patients really because we have a good uh, percentage of the population who are elderly now or
Mm,
seniors. So, uh, that is also driving part of the uh, disease burden in cardiology. Yeah.
wow, 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 wow. Thank you so
And
much.
just to add, and it used to be we thought these things were not very common, like back like in Ghana, but we are
Mhm.
also seeing an increase just because of the change in lifestyles, which is also
Yes.
slowly beginning to just the change that we've seen in the Dutch is slowly happening there
Creeping
as well. And we do have a there's unfortunately among blacks we see a lot of effects of high blood pressure, rather quick, more adverse effects or severe effects of high blood pressure. So part
Wow.
of that also drives heart disease. So
Mm,
there's also definitely an increasing incidence of heart disease in Ghana as well.
wow. Wow. We can't afford to have that here, so we need to be careful. And the funny thing is that I mean, not even funny, but the shocking thing is that we are having all the fast food chains in America coming here. So all the Pizza Huts and the rest, they are all coming very, very, very fast. And people are living, on this fast food, fries and chicken and all those kind of things. And it's creeping here very fast.
Yeah,
So,
it's true. When you come back or you see all this, it's like, oh, but then there's that downside of it, which is really, we because as we try to follow the developed countries or industrialized world, some we break everything. We take sometimes maybe the good, the bad, and the ugly as well. So, so yeah, unfortunately, so it's you are right. That is so I guess it's okay that you have these things, and it's okay to have. As I tell my patients, we all cheat. It's okay to cheat once a while. So if you have one of those fast food once a week, that's not what is going to define you. It's basically
okay.
what you do on a day-to-day basis. Yeah. One of my
Okay.
colleagues' patients asked him, "How is it that you're able to stay this slow?" He says, "Look inside your fridge. that would tell you whether that when I look inside, I can tell whether you are living healthy or not. So basically, those things are not things that people. But I know as people get busier, they begin to buy food outside more often. Then, unfortunately, we end up with people eating fast foods more frequently than they really should. Something that should be occasional becomes more of a regular thing, and that's where the problem begins here.
Yeah. Wow. 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 Awesome. I think it's a great time to now move into our next segment. So, Doc, we want to know how this journey started. I was talking to your elder brother, who happens to be my pastor, Reverend Eric, and he said at the age of 9, you were saying that you were going to be a doctor. Me, at the age of 9, I didn't even know whether I could even wear socks. So, so that will be very happy to know about where this journey started, and how from that point to where you are sitting today. I know it hasn't happened overnight. It's been a journey, maybe more painstakingly, or a longer journey, but regardless, you are where you are. I know you're going to say by the grace of God, yes, but the journey probably was long and tough. So can you share a little bit about how this whole journey about getting into medicine started?
All right, yeah, thanks, Isaac. So, as my brother rightly pointed out, I decided I want to become a doctor very early on, and so it's around age 8, 9 thereabout. And I think we had a neighbor that were quite close, and he was a medical doctor then, and I think that's where the real influence got, because my parents were not doctors, yeah. So
Okay.
they were not even in the medical field, so it wasn't something I was going to pick up from them, though they were. So, and as you said, and I really thank God for putting that vision into me very early on. I think it gave me the level of focus and ability to be able to sacrifice, and as you said, one thing to what we call delayed or deferred gratification. Because you set your eyes on a certain goal, you are committed to it. You are prepared to pay the price and see it coming to fruition. So I'm really grateful that I was able to focus very early on to that I wanted to be, and my parents were like, if that's what you want to be, then you have to work very hard. So that sort of got ingrained in me, and I knew that it was with God's grace and putting in the required effort, I'll be able to achieve that goal. But as you said, it wasn't easy, because it's as everybody knows, medical training is a long journey. Sometimes as you go, most of your friends have started their lives and going, and you are still in school. It's like you are in this unending journey of being in school, and it's like, when is it going to end? But it's so that basically, so that was where it all started, I think. So very early on, and it really gave me some really helped me to focus exactly on what I needed to do to be where I am today. And I'm thankful for all the support that I got from my family, everybody else, and to really make it happen. Yeah.
Wow. So when you were 8 and 9 and you declared your intention to be a doctor, what was the response you got, especially family and friends around? How was the reception like to what you said?
Yes. Obviously, as I said, my parents were very supportive.
Awesome.
They said, "All right, if this is what you want to do, then you have to put in the hard work." So from that very age, I knew that if this was what I wanted to achieve, then I had to keep working very hard to get to that goal. So so they were, it's kind of, I think it's probably when I could tell you down the line, when you get older, you want to be, then people are beginning, are you sure you really want, you think you can do this and all that? But I think and I have to be very thankful to God for my parents, that they were very supportive to begin with, and they did all they had to do to make sure that it came to pass. And not just my parents and my whole family to us, they also were able to really support me. Yeah.
That is awesome. So how was schooling like? At the age of 9, having this vision, it makes you super focused and everything. So obviously, I can see that it's going to translate into how you view school, particularly, let's say, your secondary school, and that. How was your life in school like? And which school do you really go to? Secondary school?
Yeah, I went to Mali, so I'm an guy. Yeah. I went to Mali school, and really, even I think really when I got to we were the first batch who went through the GSS program. Yeah.
Amazing.
Like decades down there.
So
when I think about it, I can't believe that it's been so long. Yeah.
And you know the
I think from then by the time I was in GSS, I already developed a very disciplined learning schedule. And as I will go to bed early, knowing that I wanted to get up early at dawn and study. So I'd already developed that very disciplined learning schedule, and that really helped me through. Once I went to GSS secondary school, I kept it, and it's really become a part of me. Just that discipline. So yeah, most when I'm it's that has been really I attribute a great part of whatever I've been able to the little I've been able to achieve with God's grace really to that discipline to be able to sit
Yes.
down and study and not get distracted by a lot of things going on around you.
Yes. Yes. Wow. Amazing. Amazing. So from Mali, then I guess did you go to did you enter America straight away from Mali, or you had to do your undergrad in Ghana?
Yeah, no. So because we were the first initially, the previous system was that you went straight into medicine, and some of the universities were still doing that. But I, at the time, at least, what I thought was the best medical school available. Then I decided that I was not going to go the straight route. I was actually going to go in and then go through a process of getting into medical school. And
Wow.
yeah, in some ways that was some, but as I've said, I was really determined that if I was going to get medical training, at least in my mind, I wanted to get it at
From the best.
where I thought was the best medical school available in Ghana. So so from Mali, then I went to Legon, where you had to do some couple of years of undergraduate training before you were then admitted to medical school. So
Okay.
that was what the process was like for me. Yes.
Mm.
And that I think that's where the challenge really was, when you get in there, so it was a little challenge. You really wanted to get into medicine, but some doubting Thomas's school
Yes.
discouraged, yeah, are you up to it? Are you sure? Do you have anybody in there? It's kind of looking at your background and where you are coming from. But by the grace of God, I was able to just stay focused that this is what I want to do, and I was going to give it my all, and then by God's grace, I was able to get into medical school. Yeah.
Amazing. Amazing. Doc, how difficult is medical school in Ghana?
I guess medical school, it's everywhere. It's kind of difficult. I remember us reading a book very early on. It was really written about medical school in the United States. It's called a book called Doctors. And really, there may be some differences, but then the rigorous nature of medical school, it's the same everywhere. Yeah, it's just I was just my wife and I were just talking about something, including my wife's the dentist, so she also went
Oh, wow.
this. So yeah,
I want to near your house.
So it's we're just talking about how I remember one of the books just called it, sometimes it feels inhumane pressure in terms of the amount of material you had to cope with. Basically, that's medical school. Not that the content itself of each material is very, but then you just have to cope with a lot of information being thrown at you within a short period of time to deal with. So that is really what it boils down in terms of medical school and being able to cope. So it's that's again, and if I can take a quote from the book, though, it says, "Not the smartest as one may think, but one who is able to cope with the inhumane pressures put on both the body and the psyche." So yeah, so really that's what it boils down. So it's just being able to withstand the pressure. It's really a key there, and we thank God that we were able to survive, because sometimes it was really tough. But
yeah. Wow. I just can't help but mention this, that where you are is one of the coldest parts of America. You do an amazing job. I couldn't live in Wisconsin when I was in America.
I know. We just said it. I know you stayed in the South. Yeah, we are surviving. Yeah.
Awesome. So then
a friend of mine joked that once you made thousands of miles of journey across the Atlantic, you're going to survive anyway.
Exactly. I agree with that. Awesome. So how do you end up? In the States?
Yeah, so that's good. So after medical school, I actually did my residency at Kolebu Teaching Hospital as an internal medicine specialist. So I was a physician specialist, and I was actually beginning my training to become a cardiologist in Ghana. And So we're looking at some options because at the time there was no well-defined cardiology training program in Ghana. So we're looking at some options. Where was I going to go? How was this going to happen? I had some options in South Africa, but then it was going to take a while. We're not sure of the funding, so I just had to take a leap of faith and decide that I was going to go to the United States and try my best to get into the field of cardiology, which is very tough and very competitive. But I said, because if I were to stay in Ghana, I probably will. It was more of a guaranteed thing that I would get in there and train to become a cardiologist. But looking at all the options, and obviously, I thought I was going to get a very good and excellent world class training here in the States. So that was my biggest motivation. So I had to come in here, and I think it was a tougher environment. You know, it's like you come in when you started, you're like, oh, I want to go into cardiology. It's like, where are you coming from?
Yes, where are you coming from? Yeah.
Yeah, where are you coming from? Yeah, so just because in wrestling, everybody knows that it's very competitive to get into cardiology, but just as God who has been faithful and has seen me through all the other stages, so was once again very faithful and opened doors for me and to be able to get into cardiology. So it's really it's so it was probably one of the toughest things, really, decisions to make to coming here. Basically, coming not knowing what the end was going to be, but just believing that this is what God has put in my heart and this is what I want to really do, and just trusting God and putting in the hard work to make it happen. Yeah.
Awesome. I noticed you spent some time in Syracuse as well.
Yes, it's right. So I was in practice when I got out of fellowship. I worked with a wonderful group in Syracuse, New York. You know, I always go to the coldest places. Yeah,
yeah, that's what I was
it's known for its snow. Yeah, but so it went well there. But then due to some other, we decided to relocate to Wisconsin, and so far it's been working well.
Yes. Oh, that's beautiful. That's beautiful. So this brings me to we're almost about to close this awesome conversation. But I'm looking at also, if I'm a young person watching this and I want to get into this area, particularly of cardiology and basically combining cardiology and imaging, where do I start? Or what is your advice to me if that area appeals to me, which is like I'm super excited about it.
So I guess it depends on which stage you are now in your which state of which level of education you are at this point. But basically, I think and as I've alluded to through some of the things I've already said, it's about principles, you know, that really you have to follow, and the first one I say that you have to have a vision, you know, as the Bible says, where there's no vision, the people perish. At least some versions of. So it's really you have to have a vision. So you have to be able to imagine what you want to be, and then try to work. So that gives you some sort of focus, and that goes into purpose too. But I don't want to divert too much into figuring out why you are here and what do you really want to do. But really having a vision to say that this is what I want to, and then it helps you to channel your energies and get really focused. And then obviously the next one too is really hard work. There is no substitute to that one. Yeah, it's as much as there are doors, God will be opening doors, and this thing you have to take advantage of them, and it's going to come through hard work, and then also for especially the medical field, you really have to have an element of delayed gratification, you know, instead of try to enjoy things that you can be say, all right, I'm going through this, believing that I'm going to have a good it's going to be a good ending. So I'm prepared to go through the pain and the struggles it takes to get there,
Right
because
now.
unfortunately, a good portion of our youth here today, they want quick success, and it
You want
doesn't
it
happen
now?
that way.
Yes.
It takes hard work, and as we trust God to give us favor and give us grace and strength and health and all that, it really also takes a lot of hard work to go through the medical training. So wherever you are, you just, if you feel that that's your passion, and you have to be passionate about it. You know, it says that as the saying goes, that nothing great was ever achieved without passion or without enthusiasm. So
It's true.
you really have to feel that this is what I want to do, and be passionate about it. You know, TD Jakes once said, if you don't know what your purpose is, find your passion. Your passion will lead you into your purpose. So you have to
Oh,
find what you're passionate. So you don't just want to do something, because if you are not passionate, and when the struggles come, sometimes you get easily frustrated, and
yes, good.
you may be derailed on the way. But it's really finding your passion, and then pursuing that vision, and working hard towards it. Yeah.
That's awesome. That's awesome. Wow. Look, I just had this thing just came to mind. Maybe that would be my last question. Is we used to have, actually, let me ask it this way. So, Doc, what are some of the, sitting from where you are sitting, you know, in America, where the healthcare system is world class? I mean, it's like actually the best in the world, basically.
Yeah.
Sitting from where you are sitting, what are some of the latest medical innovations, especially in the field of cardiology, that are exciting? Even for that would even be exciting to people who are not even doctors like myself. Like, for instance, I'm going to give an example. So, in my previous journey, previous corporate work, we used to organize a fair and that fair basically brought together medical devices and new technology that has just happened over the past 12 months, and they come to do an exhibition. And for me, I went to one of them, I think in 2013 or so, and I was like, wow, I saw something that really, I said, so they used to have this, you may see this as antiquated, but it was very exciting to me. So they used to have this post-operative pain pump. So it was something like a cell phone that you put on the side of the patient, and the patient, I think when they're in distress or something, they press a button or something, and then it unleashes a dose of pain. I said, "Wow, this is great." So since then, it's like my energy and my love for the things of in the medical field has never gone down. It's like, you know, so since we're aware, what are some of the latest things that you can at least share one or two with us that you will get as excited? It may not be in Ghana yet, but you never know.
Yeah, you're right. I think one of the most exciting developments in the area of cardiology over the last decade, and it's just going on from that to other, is being able to replace valves without opening up people's chest.
Really?
So initially, to get any valve replaced in your body, the process you describe of cracking open people's chests and opening up, and it's even for me that I kind of watch it, it looks very traumatic, but then it's what they have to do to be able to get access to the heart and look. But it's really that advances in that area. So we started with the aortic valve. We find ways of fixing one of the other valves in the heart called the mitral. There are technologies looking at that have started for. So I think that's probably the most exciting, that you could get surgery instead of spending 5-7 days in a hospital, spend 3 months recovering. You could get a procedure, go home the next day, and feel like nothing ever happened. I think that is
amazing,
really super exciting, and it's been a real game changer in terms of really taking care of patients. Yeah.
Wow! Oh, wow! That is amazing. That is amazing. Because look, that red cracking thing, I don't even wish it on my worst enemy.
I might tell you, we are all excited that people don't have to go through that trauma to be able to get things taken care of. So it's really exciting for us and for our patients. No.
Oh, no, you've been a blessing to us. We can't thank you enough. This is going to be an inspiration to many young people who are fascinated by cardiology or who have an interest in cardiology and people who love them as well. I think your message is very inspirational and highly informative. So, Doc, we are blessed to have you. God bless you so much for your time. And I know you are a very busy person, so getting you alone was a mini miracle. So we don't want to take we don't want to take you too much of your time, so that you can take care of the family and spend more time and take care of patients.
All right.
We'll be happy to talk to you again sometime. God bless you.
Man. Thank you so much for having me. It's been a pleasure, and God bless you for the work you're doing to really encourage our youth back home. Helping them hope against hope. Just though the situations are difficult, to keep hope alive, and it's been
Yes.
I see it as a privilege to be able to share my little story, and hopefully that will encourage somebody out there to hang on.
Oh, awesome. Oh, thank you so much, and I appreciate you many more. Thank you.
All right.